Good morning, everyone, and thanks for joining us for today's town hall. We'll get started in just a minute. We still have a number of attendees joining and popping on, so I just want to give everyone a chance, and we'll get started in just a minute. Good morning, and welcome to today's town hall hosted by HealthLinks. We're a program out of the Center for Health Work and Environment. My name is Lily Tenney. I'm the Director of Outreach at the Center and Director of HealthLinks. I'm joined by David Shapiro and Becca, who's with Helpr, who I'll introduce in a moment, who are joining us today to talk about supporting working parents through this pandemic that we're all experiencing globally. As I mentioned, HealthLinks is a program that is based at the Center for Health, Work, and Environment. We're housed at the University of Colorado, part of the Colorado School of Public Health, and we're one of 6 centers of excellence for total worker health. We've been working with over 700 organizations, providing assessment, advising, certification to help them achieve and improve worker health, safety, and well-being. So we're today in a state where we've been hearing from a number of our partners and community members with school closures across the country, shutting down for weeks or months, and leaving millions of parents finding themselves working from home while parenting. I myself am in this experience, I think, along with my fellow company. So we understand that working and supervising children during this scenario has the potential to create a lot of stress and family conflict, and we wanted to be able to be responsive to it. We've been partnered with Helpr now for a number of years, staying in touch with Becca Richter, who's their president and co-founder, and has developed this technology company as a resource for companies and for parents to provide the best caretaking for their families. And so we've invited Becca here today, who has many years of experience in the childcare industry, to give this presentation and then have an opportunity to open it up for some discussion. I wanted to mention that at the center, it's our mission to advance worker health, safety, and well-being, and we're going to be running weekly town hall meetings on topics related to COVID-19, providing you with the most credible information and most real-time information by experts in our group. So after this, I'll give you a heads up of what's to come next. I'd like to introduce formally our presenter today, president and co-founder of Helpr, Becca Richter, who grew Helpr from a boutique babysitting agency into a nationwide network of sitters servicing the top media, finance, and technology companies. She works with organizations across all sectors and all sizes. As a former foster parent and power user of her own platform, Becca is driven by her mission of achieving universal parent inclusion in the workplace. So please welcome me and join me in welcoming Becca. And before we get started, I just wanted to go through a couple of housekeeping opportunities. The first one is that everyone will be automatically muted upon joining the webinar. So when we open this up for Q&A, I'll jump back on and give some instruction about how to unmute yourself, and hopefully we can have some interactive dialogue along the way. Thanks again for joining, Becca. The floor is yours.
Thanks so much for having me. Obviously, as we probably all said about 80 million times the past couple of weeks, these are unprecedented circumstances, and I'm really just happy to lend any wisdoms that I can right now. As Lily mentioned, I have been in the childcare space my entire career and running companies. One thing that I find important to introduce to everyone is that my first company that I started actually was in 2007. And so we really opened that to the market in a time of recession, which really required extreme creativity and innovation and iteration of what childcare meant at that time when we were seeing so many people leave the full-time workforce. And so the United States has been in a what we call a childcare crisis for a long time, but that really exacerbated it. So I really wanted to call attention at this time to really think about how we're looking at the immediate and how we're really handling this day by day, of course, and then thinking about how we can be creative in the weeks and months, and how that might affect even years to come. So thanks so much. I know Lily mentioned this, so I'm one of the co-founders of Helpr, and obviously due to this situation, I've really been at ground zero and spending a lot of time in connection with CDC recommendations, Center for Infectious Disease, to really use best practices during this time, and also just general thoughtfulness in partnership with the clients that we're working with in various sectors. Primarily the one at this time being, I shouldn't say primarily, but one that has really come to the forefront, of course, being in the healthcare space, as they have obviously very pressing needs. So we're trying to be second responders to their first response. So I'm going to share my screen now. And hope everyone can see this okay.
It looks great, Becca.
Okay, great. So we really want to focus on supporting working parents through COVID-19. I'm going to speak sometimes directly as if I'm speaking to a parent, and then also those who are helping to manage teams with parents. You know what? I can drop the video right here. Sorry guys, I just need to be able to see my whole screen. Okay. So the focus topics that I want to dive into are the latest on what parents need to know about coronavirus, including CDC recommendations, productivity practices when working from home with children, tips for supporting an engaging, positive home life with activities, and configuring backup care when working from home. So to start, Lily, I imagine everyone will have access to the presentation afterwards. So I do have links to different resources in this presentation, and I really warmly welcome anyone to reach me at any point for additional resources. We have, infinite at this point in terms of interaction with children, and I just gave some samples here. So this is a video from the Department of Infectious Disease. It's just about 3 minutes, and I'm not going to play it live right now, but I welcome anyone to view this themselves, of course, later. But the overall point here is that really during this time when we're thinking about children in relation to the coronavirus, there's really less concern about children contracting it more than there is about them being really effective transmitters. And this doesn't necessarily have, it doesn't have anything to do with the biology of children and that they're very effective transmitters. It just has to do with general behavior and body control, as you imagine. So kids not understanding touching, they're less aware of touching their face. Their fluids are a little bit more fluid, if I can say that. And just generally speaking, they obviously don't have the same sort of, they just aren't aware of the way in which that they're touching things as the way that we do as adults, of course. So I'm going to tap into this, how to stay healthy, just some general CDC and California Public Health recommendations and just what we know about the virus right now. These are a lot of things that most people know, but I'm going to hit a couple points that we might not know specifics on. So of course, we all have been talking about it like crazy, cleaning hands with soap and water, 20 seconds long. There's been a shortage of the hand sanitizer. It's really important to get kids engaged with this as well, and having, if it's possible, to be able to give them their own container where they feel like it's a tool, kind of a superhero tool of theirs as well. We want to make sure that that hand sanitizer is always 60% concentration of alcohol or higher. We now know that metal can hold surfaces for with the virus for 9 days. So making sure that as we do our disinfecting in our homes daily, especially if there's people from our home leaving and coming, that we're really looking at the high touch point spaces, door handles, light switches, those sort of things. It is really important that to wash clothes on hot if possible when coming in from public spaces. And then of course, just keeping immunity high. Zinc is seen to be potentially even more effective right now, but zinc and vitamin C being very helpful tools. So I want to graze over that really quickly. So the most that we know right now, because there is still a lot that we're learning about COVID-19, is that symptoms in children, are they different than children than adults? No, they just happen to be milder. So kids are really seeing more cold-like symptoms such as fever, runny nose, and cough, and it's actually a low-grade fever. One thing that I found important to mention as of today is that we're actually seeing vomiting and diarrhea have also been reported in children. So that's important to note as signs also. Children with compromised immune systems may be at greater risk, as that's just the norm for respiratory viruses, but this is not necessarily confirmed. Or I shouldn't say necessarily, it is not otherwise confirmed. One thing that is tough, and I'm in this boat personally because I'm currently pregnant and just due in a couple months. So pregnancy and coronavirus has definitely been a concern for myself. What we're finding right now is that pregnant women don't have any extra predilection to contracting this at the moment. Obviously smaller sample size, but I think the one thing we should really, and it hasn't passed to any babies at this point, but one thing that's really important for me to mention is breast milk, as that's of course going to be a major concern as to whether or not this can be passed through breast milk, even if the baby does not contract it. The thing is that it's still unknown right now, so this is something that should be talked about with physician and healthcare providers to really decide what's the best approach if you do deliver a baby and you've been tested positive for coronavirus. So I really want to get into, and this is an area that I find really important to talk about when we think about the just modern work from home during this period of the pandemic. And that's really the new normal. So, we're all reorganizing our lives right now to figure out how to manage this. And I think it's really important to just have consistent messaging org-wide to remind people that this is not of choice. So although everyone or most people are really managing some sort of self-quarantine or shelter-in-home orders that are in various states throughout the country, it can still be hard for people who don't have children to understand what that means for people who do have children. And so there's a few points that I think are really important to help managers and those who are running teams and different projects to digest and be mindful of. And it's that currently, we really need to be aware that flexible hours are to be understood whenever possible. We do understand that many companies have shift workers. There are industries where there will always be people who have to be on the floor at a certain given time. But if in your own org, you have the potential to show flexibility in scheduling and people's workflow, it's a really important time to exercise that right now. Also, just reminding people that conference calls are going to have background noise, and that's okay. And we really have to think about not having to feel so apologetic about that at this point. There will be kids, there's going to be babies, and there's going to be pets. So just reminding people to employ the mute when not speaking rule, but to really try to find general acceptance. Schools may very well be closed through the end of the year, and parents will find their groove, but they really need that mental space to do it. And a safe space without shame is really important for that. It is important for people to know that while it's hard if your coworkers have children, that you're helping them balance workload, it is most stressful on them. There's a lot of guilt associated with it. So as I mentioned earlier, most U.S. cities were childcare deserts already in the United States. That basically means that there's less supply than there is, less supply than there is demand for center-based space and beyond. And so we really don't know what the landscape on the other side of this is. Many childcare centers may not survive this, and that means long-term care even into the summer and beyond. So really just remembering that this is not necessarily a couple week issue, and really starting to think about how we view our company, our orgs for the months ahead. So something that I can't encourage more, and this is something that I talk about in normal circumstances, but even more so now, is that employee resource groups, affinity groups, those have become really hot topics over the past couple of years. I've always encouraged parent employee resource groups, and that to be non-gendered, non-binary, really focus on involving everyone. So this is something that is seen as equal responsibility between men and women and those who are non-binary, non-gender conforming. And so this is something that I think is even more important to talk about, how as parents we can pool resources right now. And Helpr, my company Helpr, can help with that and that as well. We have lots of resources for getting those started if you do need assistance. So looking ahead, preparing your home environment and family for work. So the things that parents are thinking about right now, and the way that if we don't have children, we need to understand parents are reorganizing. So they're having to really think about what this means for their role at their company, what this means for their co-parent and their partner. How can they, a lot of families who are dual parent homes are both work from home at this point. So really sharing workspace, sharing responsibilities, how that affects their coworkers, and being able to have those real open conversations about how workflow is in their home is important right now. So again, encouraging teams to really have those open discussions and just setting ourselves up for success. And that could, again, mean a shift in working hours. If you know, for example, and I can get into this more too, if you know that you thrive during certain periods and you hit a wall during others, make those your high work period times. And those that you kind of hit a wall for, a lot of people have that afternoon lull. Maybe that's the time that you take more playtime with the kids. So preparing and reworking. So really encouraging and helping your employees in any way possible to create a better home setup for work from home. Any materials that will be helpful, of course, are going to be important right now. But again, understanding that people are still finding their flow. There are many work from homers right now where this is really the first go at it. Childcare decisions are going to be really a huge part of this period. So I can also get into this in just a few, but there's a couple ways of thinking about this right now. And the most important piece here is that we're really limiting community exposure, which means that people are going to start relying on trusted sitters that they already know and can create really honest and open agreements with about how they arrange that care. And then also, as time goes on, the care share is going to be really important. And this is a part of how I see the future of care in general is really communities coming together to share that support. So be that through sharing care, be it a schedule where maybe you hire someone Monday, Wednesday, Friday, and another maybe employee or just a friend in general hires that person Tuesday, Thursday, or be it that there's care responsibilities between two homes. So maybe as a parent, you have other children in your home for certain hours of the week so that you can share responsibilities. So of course, that's going to really be dependent on finances. The one thing that is an interesting piece to this is that there are tons of shift workers. Obviously, the service industry in many states is fully closed down at this point. And so there are a lot of resources and the people that may either have had childcare jobs in the past or they're still doing them, but they have more time for that right now. Again, I mentioned parent resource groups, and providing the, access to those on a virtual digital level right now is really important for orgs as well. So it's really important that we remind parents not to set themselves up for failure. I thought this was a really great tip and just a really beautiful share from the actress Kristen Bell. Basically just telling parents, it's a note from her child's principal that is really sharing that right now is not the time to try to reformat what homeschooling is to you. So, or I said that in a funny way, but the idea being that don't try to homeschool. This is, right now, this is about finding flow and finding, a bit more than survival mode. We want to thrive during this time. Of course, there's also opportunity with change, but this is an important time for parents to realize that, hey, we're going to be able to get some lesson plans in, but this is going to be a time of creative play, really employing reading and creativity and having time together, cuddling up together. This could be a time that people look back on as a really beautiful point in their familial relationships. So while we do need to figure out activities for kids to stay engaged so we can get some work done, this is not about sticking to the standard lesson plan. So some general work from home productivity practices that we find important to share are talking to kids about what you need and having that collaboration. Obviously, this is different for different developmental stages as to what kids can really comprehend. But if kids are old enough to understand the rules, it can pay off to run practice runs. For example, put some scenarios in a hat to act out ideal behavior. So one of that might be, I'm on a conference call. What does that look like when I'm on a conference call? And mom or dad with the kids can sit and say, this is what it looks like to be on a conference call. This is why this is important to me. Let's think of some activities when I share with you that, hey, 5-minute warning, conference calls coming up, that you can prepare to do self-exploration or work on your own playtime. Take breaks to be with the kids. People take breaks during the workday, and it's important to have that time with the kids so that there's a little bit less tension and anxiety running during different times of the day. Also, this is something that a lot of those who have newborns and are transitioning from parental leave especially are still figuring out their workflow. And this is a tip for parents of all ages now. You can work while your children are sleeping. And again, that's why it's really important to talk about flexibility with scheduling right now, because generally speaking, kids go to bed earlier than adults do. And there may be some hours in the day that after bedtime could be that time for deep work. Again, so getting in-home childcare and care share, we'll talk about those care agreements as well. And then Helpr not only organizes screen child care providers, and I'll talk about why that's a real shift for us right now, and also just manages basically people using their own communities and why that's important to low exposure right now. So some general tips and reminders for engaging home life with kids is it's about loose structure right now. Kids do need structure, but we're not going to have the same school routine that we do. Again, we're not trying to be total homeschoolers at that point. That's nearly impossible to be full-time homeschool teacher and working full-time as well. So keeping a loose schedule and understanding that the school day is not, for the kids, is not going to be the same length as it is. It's not going to be generally 7 to 2:30 or 8 to 3. And try to not fixate on the orderly, accept that there's going to be some mess, and try to focus on later in the day being that time to clean that up. Playtime. It's really important to be generous with independent playtime. The benefits of boredom include creativity, emotional attunement, and overall mental health. So one thing that research shows is the United States really overemphasizes structure in terms of instruction and just organized activity. This is actually a really unique time for us to tap into different paradigms and thoughts of education, which just gives children more time. So for an example, in Finland, for every 45 minutes of instruction, kids get 15 minutes of recess. So really rethinking this, the way that we think of play. If kids have time to really get bored, it really pushes them to think of more creative outlets for themselves. Oftentimes it just really means that they don't understand their feelings at the moment versus not having things to do. Other tips being, don't have too many materials out at any given moment for the kids. They also experience decision fatigue. We all know what it's like to, I shouldn't say we all, but a lot of us know what it's like to scroll through Netflix when there's too many options. That's same thing goes for toys and play materials. So, use the screen time. Next one, get moving, use screen time. And this kind of coincides with the next piece as well. Use our screens as the tools that they really can be. YouTube has awesome playtime activities for kids, exercise, when we can use the screens for that. Get the kids' energy out as much as possible. That also includes, taking a break to walk outside in fresh air. Most shelter and home orders still are very open to people taking walks and going to parks. So last piece being, schedule screen time for times of the day that you know that you really need that support to keep the kids engaged. And if you need more of that time, you don't need to feel shame. It's really important that during this time, we're really letting go of shame with screen time. Obviously, we don't want our kids to live on a screen. It's not great for development. We all know that. But giving an extra 10 minutes here and there is not going to kill us right now. So planning the day without childcare, I'm going to run through these few slides rather quickly because a lot of them are actually similar depending on age groups. So we have 0 to 2. The next is 2 to 4, and then after that is 5 to 12. So basically helping, for co-parents, getting organized, taking turns with care and duties. When you have a baby, of course, thinking about rotating of feeding periods. When you have children, rotating between who has certain care responsibilities, such as just, lunchtime, those things. And again, really taking the time as co-parents to determine, everybody's best workflow schedule so we can take it to our advantage. Single parents, again, this is something that I ask for just extra as a member of society, ask for extra sensitivity for. This is going to be an extremely hard time for them. Again, finding their best work hours, using them to their advantage. That sleep time for the kids could be really important for them. And really attuning your body clock to when available to best work. Again, care share is going to be even more important for single parents, and letting the team really know your schedule. Hey, this is what my kid's day looks like, so I'm going to work around that to some extent. It's a lot harder to adjust a child's clock than it is an adult's. So 2 to 4, it's really similar idea, except for we're going to now start to stockpile as many activities as we can each day. Sometimes this looks like a list of crafts, sometimes just ideas to get ready when we notice the kids are acting a little restless. Single parents, again, that's going to be even more so important. So these don't have to be elaborate craft kits and ideas, and we'll have our own stockpile of those for those of you who want to reach out. But the idea is bringing safe materials to the foreground that don't need to be supervised and that aren't so messy that you're stressed out about it. And then one more thing, because a lot of this is really repetitive even between the age groups, but once your kids are of elementary age, really encouraging older siblings to teach, and vice versa, reminding your older children to allow the younger children to teach them too. Khan Academy is a great nonprofit resource for children with curriculum, children 4 to 18, that can be another great use of screen time and interaction. So I'm going to just go over this really quickly, but 'cause we're getting close to point of Q&A. But activities to do with kids during school closures, quarantining, or any time. Things that can keep kids excited. Kids don't really get to bake a ton, generally speaking. So using that as a reward for good behavior that keeps them engaged. Obviously, this is time that does have to be engaged for safety purposes, depending on ages. Letting your kid pick a weekly learning theme and every day putting 30 minutes towards that. This is also a time that we can really reach out to our community for support too. So keeping in touch via email, pen pals, letters, FaceTime with grandparents and relatives. So really, if again, screen time can be used in a creative way, might not be the best time to visit grandma and grandpa, but it would be great to do as long of a FaceTime session as possible with them. So I'm gonna leave that.
I want to jump in here just because I think that's a great segue into a lot of the questions that have come up already on the chat, as far as I think, whether it's grandparents or whether it's child care sharing, nanny sharing. Is that something that's recommended right now? And can you address the social distancing recommendations of child care share as far as managing the spread?
Yeah, exactly. So let me scroll down then just to a slide that I think is important right now is the care agreement. So for example,
right.
We have, our company does have screened backup childcare on demand. Right now, we're really starting to look at the way that's framed a bit differently. So another piece to our program is basically managing subsidies to offer backup care. And the reason that I even mentioned that in terms of our current services is just to talk about how we're thinking about this time as a company. So we're less encouraging of our, higher touch point on-demand care where there's maybe strangers coming into the home. Yes, that works for families who have already maybe established relationships with babysitters through our platform, but that doesn't work for most families that are trying to figure out care during the next few weeks ahead. So we really need to think about looking to our close-knit community. So families generally have, especially now because of so many people being really out of work, families generally have someone that they can reach out to for support. We do understand that there's a financial burden to this. We can get into that later in terms of how our services work. But that being said, this isn't necessarily the time where parents are looking for, getting to find a new babysitter. This is about tapping into the people that they already know. And again, so we do have to be aware of certain exposures between children and the elderly community. But if you have a sister-in-law who's out of work at the moment, or you have a babysitter you've worked with in the past, this is a good time to really reach out. So the things that we think are important when we talk about getting started with a new care arrangement in home is what that means to exposure. So coming to an agreement as to what your containment community looks like. So you can't really just invite someone to the home, be it a babysitter or even your sister-in-law, without really talking about what their exposure is currently looking like right now. So for example, does your babysitter have roommates? What is their roommates' lifestyle practices? Are they going to the grocery store still, or are they getting their groceries delivered? Are they, going to the park and going on walks with friends still to do that? Or are they committed to really, truly doing a shelter in home? And that also goes for if you're doing care shares, for example. So if you have decided, hey, we're going to get help from the sitter Monday, Wednesday, Friday, and this other family is going to have the same sitter Tuesday, Thursday, understanding what those families' roles are too, because your exposure is going to be what their exposure is. As soon as you introduce someone who's interacting with those people, you've now expanded your exposure exponentially. And so even if you might not, even as a parent, if you might not know this other family, this is a really important time, really beautiful time to get to know these other families that you're really depending on in this important time with. So getting on a phone call, getting on FaceTime to really talk about shared rules and what everybody's comfortable with exposure-wise. So that's, I'd say, the first point there. The other thing is getting to know, there's two other really good I think important practices here. Lily, cut me off if I'm being too verbose.
No, this is helpful. I think
Okay.
a lot of the questions that people have raised have been around this and best practices of when to have these conversations and how to have these conversations.
Okay, perfect. Okay, so when let's say that you are going to, you're a parent and you found a babysitter that, maybe you had picking up the kids for summer camp a couple of years ago. She's now back from college. All the universities are closed. So she's someone you're depending on right now for care. It's really important to have the conversation about what's the best case schedule for her. Best case schedule scenario, and know that things change. So what I mean by that is to say, if this sitter knows that her school is now out of session through it, we're at March 23rd, and she says, hey, my school's been canceled for the rest of the year. I'm here. I'm really looking for hours for as long as I can while I'm home. So that's the ideal situation. Great. You might have your Monday, Wednesday, Fridays locked and loaded, but we need to really encourage open communication about that change, because you don't want to put your family at risk just to stay true to that schedule. So it's really important that you encourage her to be honest. Hey, are you feeling any symptoms at all? Or is your roommate feeling symptoms? Or do you know that, you were around someone who now might have a confirmed case? So again, really being open about what that means. So it's also important, I think, that to me, it's always really important for both the care provider and anytime care provider and the families to understand that this is a mutually beneficial and arranged agreement. But even more so now, it is important to think about exposure for your care provider as well. So to really have open dialogue on both ends, so that your care provider, as they're coming into your home, that they understand what that exposure looks like for themselves and their close community too. So again, and your community is all shared at this point. And so if you are noticing that your children are having symptoms, or your partner, be really open about that. And we really recommend that as soon as there are symptoms, we're hearing that tests are being more prevalent. I haven't personally experienced that yet, but we're hoping that tests will be more accessible to everyone so that we can kind of nip this in the bud. We don't necessarily have to wait 14 days before we can have a care provider in our home again. That's actually really difficult for everyone. So something that is also a great practice, if you have the financial ability to do this, offer paid sick time if you can, to encourage honesty. So obviously a lot of these people are going to be care providers on a paid level, are going to be those who are already out of their work. That's been a financial burden. And so those people now still want to be encouraged to be honest if they have been exposed to someone or feeling symptoms. If you can say, hey, just be honest with me, we can figure out maybe a couple paid sick days, that still helps something. Or paid sick days till we can get you tested, for example. So I understand that's not something that's available to everybody, but just a reminder that when it is within range of possibility, that's a great approach too.
So it sounds like, these are great tips, and I know it's such a complicated situation for every family that's having to figure this out right now, especially with the range of parents that have infants at home and have a different set of needs compared to those with school age parents and are working on the homeschooling and having those conversations. I'm wondering, and I do want to open it up for attendees to have an opportunity to ask some questions, but I'm wondering through this, how you're working with companies to help ease some of those conversations that are happening between managers and supervisors, and what recommendations you would give to individuals to be able to communicate those needs better to their to their employers.
Yeah, well, I think the most important thing is reminding people that it does start with management, and really asking as an org that all the managers have that talking point with their teams to say, number one, we realize that these are totally different times, and that you're working with a lot right now. So actually, I think the first piece here is remembering that we don't always know who even have children. Some workplaces are really open about that, and that's communicated. And but we also see that there's a lot of companies that aren't necessarily so family culture focused. And so, first of all, even having that conversation with your teams as a manager to say, again, reminding your managers that it's important to open this up themselves to say, hey, first of all, if everyone can share with me, who's a parent here, who now has children in their home, whatever you're open to sharing in terms of how that changes your schedule, I would love to know better about. And so not putting that on the parent to have to come forward to say, this is what I'm dealing with, but on the manager side to say, how can I help you during this time? And can you please give me some color as to what your home life looks like right now? Obviously, that can be a sensitive conversation. But this time is, of course, one to employ as much sensitivity as possible to say, yeah, how old are your kids? What does their schedule look like? I mean, it is really interesting. I've seen such a wide range of in terms of management understanding their teams and their employees and who is really dealing with what, and also even understanding that this cannot be seen again, like this is a big problem in this country, is still how much childcare is seen as a woman's burden. And so remembering that just because someone is a man doesn't mean that he doesn't have equal childcare responsibilities right now, and encouraging him that matters as well. So does that kind of cover it, or anything I should dive into more?
I think that's great, and it's something that we've been talking a lot about at HealthLinks with our businesses, is how that's going to change day to day, especially as you're talking through this care agreement, and whether or not you have hired care providers that are isolated by contract, I think is something that can be part of that discussion. And then if that changes the next day, how that ongoing check-in needs to be happening among coworkers and among supervisors. So that's a great point.
Yeah, I think it could be a week-to-week conversation, honestly. And I also do believe that it's important, again, for managers to say, hey, we're going to do these weekly check-ins to make sure that I know what's going on with you. But please come forward if something has changed, if your care provider is left. But again, we're really remembering here that it's a financial luxury to be able to pay for care right now, that very many families out there will not and do not have. So it's not necessarily always about, this care agreement. It is also about just understanding that this could be totally managing this by yourself. And again, why we can get to this at some point, but why I think that as an org, if you have the luxury to be able to offer some support in this way right now, is important too.
Great. Becca, we have a ton of great questions and thoughts coming in the chat. Can I please now, if it's okay with you, give some instructions to our attendees here. If you go into, you have an option down at the base of your window to unmute yourself and to also start your video. I want to give everyone the opportunity who has questions or who has comments on this topic to chime in. And while we have the last 15 minutes reserved for Q&A, go ahead, jump in.
Becca, this is Lee Newman. I want to thank you for giving this talk. It's just very, very helpful and very clear.
I'm so glad to hear.
My question to you is one that I'm almost afraid to be raising, but I'm wondering what your perspective is on the potential that we may see for domestic abuse. and what thought we should be giving to that. Because I think as a society, when we start having people in confined spaces together who are not accustomed to that, under the kinds of stresses that we're experiencing right now, I think we're going to observe an uptick in those kinds of issues. I'm wondering what you've thought about that.
That's really interesting, and thanks for bringing that forward. To be quite frank, we've been talking so much about the stress and how that, really, again, this is why a lot of what I mentioned was about no shame time. Make it easy on yourself. Employ screens when you feel you need to, again, so that we can, minimize that as much as possible. I'd say that it is important for managers to watch out for additional cues of stress and changes in behavior. In terms of the way, I don't know how much I can answer in terms of how an org can be really helpful to that, mitigating that, other than to say that if, again, those cues of someone being really kind of out of sorts, and if we can, again, give, PTO, I don't know if I mentioned this earlier, but if we can give PTO during those times, that can be really helpful as well. Just saying, just for someone to take a couple days off for rest if they're not being paid is not going to help anyone. But in terms of, just so you know, the way that we look at care, and if we're ever sending a care provider to the home, they are mandatory reporters, and so if there's any evidence or best understanding that there may be abuse, that would always be something that would have to be reported to authorities. So though like I said, I can't speak to too much about how, as from work, at a distance from a virtual world, as managers, we can really avoid that, other than to say that we really need to be so thoughtful of not adding undue stress to people right now.
Yeah, and I think too, as partners, whether that's you as a single parent reaching out to friends at a breaking point, or needing to actually reach out, even in the cases where ultimately you would discourage any outsider from coming in. I think balancing what your needs are for your mental well-being to mitigate any adverse outcomes is a top priority.
Yeah, the parent resource group thing I think is really important. Like I mentioned, I have a lot of resources for helping orgs get those started, but having a safe space to talk about not just workplace initiatives having to do with children, but also just what that daily experience is like. And that's a time where people can commune and share resources. So traditionally, those parent resource groups meet monthly or quarterly. I'd say even this time, maybe encourage a digital check-in on a weekly basis. Like, hey, did you guys have any tips this week as to how to handle a screaming child in the background of this age, et cetera, et cetera. So.
Great. Other questions? One great reminder that just came in from Deborah O'Connor is if you are offering an employee assistance program, or you have access to an EAP at your company, to find out more about that and be doing the best you can to promote the types of services that can offer to employees. I think that's a great resource.
Yeah, those are really great resources. I want to also just be wary of empty programming. I think that's a lot that comes up in like the parental benefits space for us. Why it's really important for us, why we've really adjusted our suite of services right now to think about how to really manage care. So there's EAP programs, for example, that's sourcing childcare, and that can be like someone on the other end just doing some Googling that a parent can do. So before really sharing with parents the different types of programming and assistance that you currently have, doing a real deep dive on what that looks like, so you can be honest with yourself. Is our company prepared for times like this? Is this a true assessment of how to help families? Because if not, it can just be extra noise for them right now. So I think that's important to mention too.
Right. Does anyone in the wings have a question for Becca, myself? We have Lee Newman and David on from our team that are available for questions as well. Okay. Go ahead, Becca. I know you might have, do you have any kind of parting words here? I have some closing slides and want to make sure that you covered everything you were planning to today.
Yeah, I think I'll mention too, we're doing a lot of remote support right now as well. So please do check in if you would like extra support. So that looks like virtual tutoring, at-home lessons, music classes. So something to engage the kids, as I mentioned, using screen time more effectively. I'll mention here just the way that, again, we are looking at our general, I'll run through this really quickly. Our suite of services is basically backup care that is really focused on trusted providers in that shared community. So basically we have a tool to manage that schedule. And then also for companies, if you want to be able to provide any subsidy for those families so that you can help pay for those services. And this doesn't have to be a long-term support. This just can be, 40 hours even to help for this next year period. And again, really encouraging shared care. We have an FSA tool that will at least help in accessing pre-tax dollars that it works in conjunction with DCAP FSA. So this is basically in the United States, 90% of care is done informally, and so people aren't able to access 30% off those pre-tax dollars. So that can be helpful, any savings right now. And as I mentioned, really thinking about EAP programs and how they can be effective or ineffective. We also do have one-on-one consulting concierge services for families sourcing care. Even if you're having this out-of-network service, we do understand that there are some families that just don't have the contacts. We can help find people locally and do really deep vetting on those providers as well. So those are a few things I just want to share that we're doing right now, kind of ground zero, thinking about how family solutions are moving forward. And we're definitely going to take this time ahead to think creatively about how we can be long-term resources. Our core care program is usually used for finding primary care. Right now it's about finding really emergency care and making sure that emergency care is super safe. But yeah, I just wanted to mention that. So you can always, again, check in with me directly or our website for any extra resources. There's also, sorry for anything dizzying with this presentation, but I have up here, let's see, some disc care activities. I think it was a slide in here, but we'll make sure that it's included. It's basically a list of activities to do with children. Oh, it was on that one slide that I was mentioning some things that we can do with our kids right now. But we can also compile more of those lists to be helpful too.
That's great. We've recorded this presentation. We plan to post it. We encourage you all to share it with your coworkers and with your friends and your network. So we'll make sure to get this out to everybody and to get your information, Becca, to folks in the case that they have questions or if they're working in companies where they want to set up a time to meet with you for more information.
Great, thank you so much.
Yeah, and so again, thanks so much for everyone who joined today. We're looking at kind of minute by minute. In a way, I feel like we're experiencing Groundhog Day. And Becca, you did bring up a lot of the issues around perceptions among coworkers who are in different situations. The role that leadership plays in this from the perspective of ensuring health and well-being among their employees as well as providing benefits. So next week, we're going to have Lee Newman, who's the director of our center, and Dr. Gwen Fisher, who is faculty at Colorado State University and an expert on work-family issues, join us to give a town hall at the same time. This is 11 to noon Mountain Standard Time on Monday, March 30th for leadership skills for managing worker stress and fatigue. And so, you know, today we talked about the how you know, we as working parents can continue to try and balance being, you know, getting our job done, and also in this new world be caregivers and parents. And next week we're going to be really talking about the role that managers can play, but also that you as team leads and even as individuals can play to help manage the stress and fatigue that we know is already present. So Dr. Newman and Dr. Fisher are going to be talking about skills that leaders can use to promote workplace safety, health, and well-being, sources of stress and tips on how to reduce impact, and also fatigue and sleep, and how to really have some simple steps in place around resiliency. So I encourage you to join. David Shapiro from our HealthLinks team, program manager, posted a link on how to sign up for our mailing letter. This is where, in LinkedIn, Facebook, Twitter, and our website, we'll be posting the recording from today's town hall and making sure you get the materials that Becca presented from her company, Helpr, as well. So thank you all so much for joining. And if you have questions directly, please reach out, and we'd be happy to schedule an advising session with your company to talk about what you're doing, what your business is doing to help promote and really support well-being of employees during this time. So I wish everyone well, and I want to thank you again, Becca, for jumping in and giving this information on such short notice. This has been really helpful, and we're really grateful for all of you. So hang in there, everybody, and thanks again for your time today. I wish you a good week.
Thanks so much, everyone.